Hey,
Hi.
Jessa, how are you?
How are you?
I'm awesome. How are you?
Good to see you.
Good to see you too. Well, it's been a minute, huh?
It has.
Okay, well, let's take a quick look here. Okay, so what's going on?
Well, okay, so I've been really working and I've been working out a lot. And
Okay,
I've
that's
lost yeah.
Okay.
But so since I've lost a lot of weight, I've noticed that this is kind of thinning out a little bit. And so when I lean forward or when I kind of feel ripples.
Okay, okay.
And I mean, it's been almost 7 years since my last.
Wow.
Yeah.
Really?
Yeah. So I think it's time to upgrade.
Okay, well, I'll just explain a couple of reasons why this could be happening, all right? Your implants are under your muscle, okay? First you have your gland, your breast gland, then you have the pec muscle right behind that. The implants are behind the muscle. So you don't notice any rippling in the middle of your chest or in the top because you have these two different tissues covering it. But in the lateral part of your breast out here, there's nothing but skin and a little bit of fat. In some of my patients who are athletic or low body fat, lean, normally, they tend to start to see or feel the implant out here because there's so little tissue between the outside world and the implant. And those patients I usually try to discourage from having a saline implant because saline tend to ripple a little bit more. But you have silicone cohesive gel implants already and you're still getting a little bit of rippling. And that's pretty much due to your low body fat. For patients like you, what we do basically, what I recommend is what they call an overfill cohesive gel implant. Some patients call them gummy bears.
I've heard that, yeah.
Yeah, you know, that's colloquial. It's not really a proper term. What it means is a cohesive gel implant. Basically, if you cut that implant in half, there's no liquid in it. It's more of a gel that's kind of stuck together. And it does two things. It actually maintains the shape of the implant better, and you know, it also maintains the projection on your breast. It looks a little nicer. So what I would suggest is changing these implants, which would have had to be changed soon anyway, and replacing them with this overfill implant. I'm just going to show you a quick example. If you look at both of these implants, this is what you have right now. This is a moderate plus cohesive gel implant, and this is a high profile cohesive gel implant, but this is what you call an overfill. And if you look at it, what's really nice about this implant is when it sits in the pocket, basically it almost takes on an anatomic implant shape. You know, there's a recent study that was published where they polled plastic surgeons and they had them look at patients that weren't actually their patients to see if they could tell the difference between an anatomic, a tear-shaped implant, and a round implant, and they couldn't. And I've been saying this for many years. You know, patients always ask me, hey, do you do teardrop implants? Do you use that? And I tell them, well, no. And they say, why? And I say, well, if you look at a gel implant, when it's sitting and it's sitting in your breast pocket and you're standing upright, gravity kind of makes it into an anatomic or a tear shape. The good thing about a round implant is that no matter what position it's in, because the implants do move and you know this in your chest with activity, it'll always be round. With an anatomic implant, sometimes your breast can look a little distorted if it's not just sitting appropriately. And we'd like to avoid that. And because of that, I always use round implants. I think this implant, here, feel it, is actually probably a good choice, and it'll help eliminate a lot of these issues that you're having with your older implants.
Okay.
Does that make sense?
No, it does, yeah.
Okay. Do you have any questions about this?
So would this be the same size?
Yeah, we can get an implant that's exactly the same size as yours.
Okay.
Just change the profile, which will make you look a little bit more athletic. I think it's more appropriate for your body now and your lifestyle. It's a little narrower. It'll make you look, it won't make you look heavy, and that's not what we want.
No.
So now that your body has changed, we want an implant that fits you more appropriately. What we're going to do is use the same incisions that you had previously, which are minimally detectable anyway, because they've healed so nicely. We'll use that same incision, remove your implants, and place these new ones. Okay, you will have to have surgery under general anesthesia, all right? The surgery itself will take about an hour and a half. It's done here at our surgery center just like your last one was, and you'll get to go home the same day. You'll be able to do most of your normal activity without any heavy resistance exercise after 2 weeks, and you can be back into full training, including CrossFit or wherever else you're doing, at about 4 weeks.
Okay.
Questions?
No, I'm excited.
Okay, well then what we'll do next is we'll have you spend some time with our practice coordinator, and she'll set up a date that works for you. We'll also set up your pre-op appointment where you'll get some of your lab work done and some of the paperwork that's required for this. If you have any questions between now and then, you have my contact information. You can call me anytime.
Perfect.
Okay?
Yeah.
Great. It was
Yes.
really, really
Good
good
seeing
seeing
you.
you again. Okay?
I know,
So,
thank you.
Take care.
Thank you so much.